report has found that large increases in healthcare funding and staffing in recent years have simply not been matched by a similar level of rising activity within Ireland's hospitals. The report, drawn up by personnel in the Irish Government Economic Evaluation Service and the Department of Health, says that the health budget has risen from, and these are huge figures, 13.7 billion in 2014 to 22.8 billion in 2024. That's not far off a doubling, and that more than 50,000 additional healthcare staff have been employed. The data is expected to be used by the government to make the case for addressing productivity challenges within the health service. Shane, what do you make of it?
It confirms, Ciara, what we've all suspected, that we're not getting value for money from the huge additional spending that goes into health. Employees are up, bed numbers are up, but according to Martin Wall's report today in the Irish Times, average outpatient appointments per consultant, for example, is down. Activity levels, in short, are not keeping pace with spending increases. And it just strikes me, we regularly get representatives on from consultants, from doctors, from nurses, from other groups, other vested interests in the hospital sector. We regularly get them on the show complaining about the health service. And there are things to complain about. There's no question about that. But it strikes me that we in the media have a role to play as well. And that's to ask them, what are you doing to help the situation? Because we are not getting the kind of flexibility that is required. We're not getting the changes in work practices that are required to actually improve our health service. And until we get that, we're not going to get value for money. I've always thought about the health service that it is first and foremost run for its employees rather than the patients. And I think that needs to change.
I'm loath as I am to say it. I think that's true of most of the public sector. We saw very similar things when they tried to change the Garda roster because they said that would improve policing, and we almost had a strike among people who aren't even allowed strike. So I don't think that the health service is alone with this. I think the health service, to be truly efficient, would have to run a 7-day working week, a rolling 7-day working week. We don't have that, and we regularly hear from the INMO on the Tuesday after a bank holiday complaining about A&E numbers. But that's because of the working practices that we have within the hospitals. That's because we have an extra day off and we don't have that rolling 7-day week. That's why there's always a lag on the Tuesday after bank holiday. They're complaining about it, but they would fight against any change that would fix it. Having said that, there are brilliant people in the health service and they work really hard. And I actually suspect that they're a bit too close to the issue and that they resist change because of a lack of trust and the fact that they're probably quite burnt out already. And so actually the working practices don't suit them either. I think I think it needs a very broad reform, but whether or not that's possible and who would actually bring that about, I really don't know, Shane.
Yeah, but look, you know what? It isn't good enough, Ciara. If we've, I'm back of the envelope calculation. What's that? An 80% increase in spending since 2014,
it's huge.
And we're not getting value for money for that. And, we've seen ridiculous examples, really extreme examples. There was the maternity hospital in Cork a number of years ago, which delayed opening because there was a row over literally who would screw in the light bulbs. I mean,
Yep.
that is bonkers.
We saw a row in the Coombe recently, wasn't it? Because they wouldn't carry mobile phones. Even though they were all carrying mobile phones, of course, anyway, but they wouldn't carry mobile phones and take texts. This is I think the technical electrician staff.
Okay, well, listen, we will come back to this story in a few moments. Let us know your view, 087 1400 106. What changes need to be made to the health service?